We ready, Tim? All right, good. Thanks, everybody, for joining us today. We're really proud to make today's announcement, which is the latest step in the MTA's nation-leading response to COVID-19. Starting tomorrow, our own employee vaccination program will be up and running right here at 130 Livingston in partnership with Mobile Health. The state and the CDC have rightly recognized our heroic workforce as a top priority for inoculation. Our workforce has been eligible to be vaccinated since phase 1B of the rollout started in January. We've said from the beginning that we wanted to facilitate access for all employees who are interested in getting a shot so that they can continue to do the heroic job that they've been doing and also maintain their health. It made sense for us to help coordinate this effort ourselves to ensure access. The safety and health of our dedicated employees is our top priority. Here at 130 Livingston, we expect to deliver 200 doses a day or 1,000 a week. That's in addition to the hundreds of shots per week for MTA employees at the Javits Center. We're doing everything we can to see additional transit workers get vaccinated. To date, we're proud to say we've gotten shots in the arms of over 10,000 transit workers. And we have another 10,000 transit workers already signed up to get the vaccine through our portal. We want to see that number much higher, much higher. However, our efforts are dependent on vaccine supply and availability provided by the federal government. So we ask that our workers be patient pending delivery of additional doses for their time to participate. We recognize that some of our colleagues may be hesitant about getting the vaccine. But the data has been quite clear. The CDC and other public health experts agree that the available vaccines are safe and effective at minimizing severe risk of illness. And I'll be getting my first dose today to show that myself. I'll also note that last month, Dr. Fauci attended the MTA board meeting by video and delivered a personal message to MTA employees to get vaccinated. That's really important. I want to thank our partners at Mobile Health for helping us to launch this critical program this week. Mobile Health has a long history of serving New Yorkers and promoting community health and workplace health, and we're thankful for their support. Today, you'll also hear from our colleague Robert Worthy, who is a surface line dispatcher at New York City Transit. Mr. Worthy has already been vaccinated twice, and he has a message for all MTA employees to get their shot when they have a chance. I'm now going to turn it over to my colleague, Sarah Feinberg. Sarah.
Thanks, Pat. Thanks, Pat. I'm thrilled that our amazing employees will now be able to take advantage of this program. They're truly heroes moving heroes of this pandemic, and I thank them today and every day for their hard work and dedication. 130 Livingston, where we are today, will be open for vaccinations from 9 a.m. to 9 p.m. Wednesday through Sunday. It was important for us that this operation be open on weekends so that subway and bus employees in particular could make it work with their schedules. We chose 130 Livingston because it's a central hub and it's easy to get to. Those who are interested can register online through the COVID-19 portal on the My MTA intranet. They can fill out a questionnaire, and then the MTA's various agencies, Transit, MTA Bus, Long Island, Railroad, Metro North, and B&T, will schedule based on employees who express interest and make an appointment. Like Pat said, we want to see as many employees as possible get through the vaccine. I'll remind our workers that they're not required to go through the MTA's program. Under distribution guidelines, they are eligible across the city and state to get their shot anywhere that's most convenient to them. We just want to provide another channel for them to get it. We have suffered far too many losses at MTA already. Transit workers have carried the city on their backs, and if we're going to get back to normal, we need to step up and all get our shots. Beyond the vaccine, we need to use all the tools available to us. We need to continue following the same guidelines we've had all along. We need to keep wearing masks, getting tested, maintaining social distance, washing our hands frequently, staying home if we feel sick, and avoiding unnecessary travel. I thank our customers for wearing masks. We continue to be at 96, 97, 98% compliance throughout the transit system, which keeps not only New York safe, but all of our employees safe. Thank you again to the folks at Mobile Health for their partnership, and I'll turn it over to Mobile Health CEO Andrew Schulman. Thank you.
Thank you. Thank you, Sarah. I'm incredibly proud to be here today, part of this really important vaccination initiative that will protect our city's employees, transit employees, and move the city a big step closer to a return to normal. My name is Andrew Schulman, and I'm the Chief Executive Officer of Mobile Health. Mobile Health is New York City's occupational health provider. We started 37 years ago in Manhattan with one van and a commitment to provide employee screenings, disease testing, drug testing, and services that keep employees healthy, and we focus on New York City's essential workforce. That same commitment continues today. We now have 7 offices across New York City and partner with about 3,000 urgent care centers across the country. Each year, we screen approximately 250,000 individuals, all with one goal, and that's to keep employees safe and healthy. The partnership with MTA makes sense on a number of levels. Whenever we look at opening up a new location around the city, the first thing we look at is our proximity to mass transit. We rely on the MTA to bring our employees to work, and we rely on the MTA to bring our patients into our offices. It is an absolute pleasure to be able to give back to the MTA the way that they have given to us and powered our business for almost 4 decades. Safety is our number one priority during the next couple months while we're here vaccinating. We will be providing nurses, emergency personnel, medical assistants, pharmacists, support staff, and the underlying technology to support a rapid, quick, efficient, and safe program. By bringing the vaccine directly to the MTA employees, we hope to increase the participation and utilization rate and increase the safety for both the riders and the entire workforce. On behalf of Mobile Health, thank you to the entire MTA team for your partnership, and we look forward to a successful program. Thank you.
Thank you so much. And it is my great pleasure to introduce Robert Worthy, Surface Line Dispatcher. Robert?
Thank you. Hello, my name is Robert Worthy. I'm a surface line dispatcher with New York City Transit, stationed out of QV Depot. I became a dispatcher. I joined transit 22 years ago. I drove buses for 17 years, and I've been a supervisor for 5 years. I got my first dose of the vaccine January 13th. Soon as it became available for New York City Transit employees to get the vaccine, I signed up immediately. I wanted to be a part of the solution then. Since then, we've had a lot of deaths in New York City Transit. We've had 4 bus operators out of my QV Depot that have passed away. One just passed away last week, Mr. Joe Williams. I'm hoping that we can put a stop to that. I'm tired of saying that I'm sorry someone passed away. Perhaps if we all start getting the vaccine, we can stop saying goodbye to some of our coworkers. My condolences go out to all the people that have died and have lost their lives to this pandemic in New York City Transit and across the world. I got the vaccine, and I was really hoping that the main thing that I want to accomplish with getting the vaccine is I want to see my mother. My mother's 84 years old, and I haven't been able to give her a hug in over a year. I'm looking forward to doing that. More so, I'm looking forward to getting a hug from her. I miss her. I miss my dad. I miss his wisdom. Talking on the phone is one thing. Shaking his hand and giving him a hug is a whole nother thing. And that's what I want to get back to. And it starts with getting the vaccine. I feel a lot more comfortable now, I find. Since I've gotten the vaccine, it feels like a burden has been lifted away from me. Sure, I'm still wearing my mask, and I'm still washing my hands, and I'm still doing all the things that are suggested to do, but it feels like there's a weight off me. I would suggest you get the vaccine. I understand people's hesitancy with the vaccine. My experience with the vaccine was I got the first shot, it was no problem. I was told I would feel some symptoms with the second shot. I didn't feel anything. It was another shot, a little soreness in my arm. I went about my day. No side effects, no headaches, no dizziness, no fevers. So for me, it was a good experience. I would suggest you get it. Thank you.
Questions? Questions? So let me start with quote of the day, Robert Worthy, a mother's hug.
Pat, just clearing up some data first. 10,000 transit workers, MTA employees vaccinated. How many in New York City Transit? And what percentage are fully vaccinated?
So I don't have it at my fingertips, but Pat Warren will come back to the press shop and get that to you, Clayton.
Okay. And you've seen an uptick in deaths so far this year. There's been a citywide rise in COVID cases over the holidays. Has that impacted your ability to put out crews or provide full service as it did last spring?
So just to be clear, during the holiday surge as well as all of 2020, our rate of infection was about half the city's. That was also true in the holiday and post-holiday period. Obviously, we grieve and mourn the loss of every one of our colleagues and all New Yorkers and Americans who've been, yesterday President Biden observed the death of the 500,000th American from the pandemic. And the point of today's announcement and the program that we're running at Javits and the program that we would be running here at 130 Livingston and other places subject to availability is to reduce sickness and minimize health risk to our employees.
But in terms of service, have you seen any impact
No.
with crew service? No impacts on service due to unhealthy workers. Okay.
Hi, Pat. Question for you and Sarah Feinberg. In 2 days, it'll be 1 year since Sarah Feinberg was appointed interim president of New York City Transit. Why is she still interim president?
Is that your way of saying happy anniversary? Thank you so much, Dan. Look, we have a lot on our plates, global pandemic and not to mention just continuing to deliver service for 3 million people a day. So frankly, I don't spend any time worrying about or thinking about my title, and I think when we get to the other side of this, Pat and I will sit down and figure it out.
Would you like to be permanent?
I think we'll figure that out when we get through the crisis at hand.
Two questions. One, given the ongoing supply problems all across the city has been running out almost every week towards the end of the week. Do you have a dedicated supply for this site and for transit workers at Javits?
Yeah, we've got allocations at Javits. We've got allocations here. Fundamentally, it's dependent on vaccines from the federal government. And the 10,000 MTA employees who've been vaccinated, some of them like Mr. Worthy twice and some of them just the first dose. It's all dependent on distribution and allocation from the federal government. The president has announced increases in allocations. Obviously, the terrible storm in Texas has impaired manufacture to some extent. But yeah, we're optimistic, Andrew, and we've got we've got 10,000 people who've signed up on the portal, 10,000 MTA people. We want to vaccinate all of those. And every other one of our colleagues who's interested in being vaccinated.
And Pat, just curious, you yourself had COVID. There's been some literature about folks who've had COVID maybe only getting one shot. I'm wondering your own philosophy on that. Are you planning to get?
So I'm going to get a shot today and in a little bit, and I'll leave it up to the doctors with respect to the second shot.
I'm good.
Great.
Thank you.
Hi, what do you hear about vaccine hesitancy? How has that changed over time? And how much of a concern is that?
Well, we're concerned about it, Peter. Obviously, Governor Cuomo at an event yesterday talked not about hesitancy, but about trust. Obviously, the fact that in a relatively short period of time, Pat Warren and Dr. Luisi and the MTA safety team have been effective in inoculating 10,000 of our colleagues. That's why we had Dr. Fauci appear at our board meeting a month or so ago. Obviously, the firsthand testimony, which I found moving by our colleague, Mr. Worthy, he's here to talk to his colleagues, right? And that's the same reason that Sarah and I are here and why I'm going to get the shot today. We want to make sure that every MTA worker who wants to get vaccinated has access to vaccination, 1 dose or 2 doses, depending on the particular vaccine as soon as possible, and that's why we're proud to stand up this facility today.
Have you surveyed how many people say thanks but no thanks?
Yeah, so good question. So here's the data. 10,000 plus of our colleagues have been vaccinated. 10,000 plus have signed up on the portal. The number of people who've reached out on the portal and said they're not interested is a small fraction. Our goal is to vaccinate every one of our employees who wants to be vaccinated. And that's why, we've been sending people to Javits, and it's why we're standing up 130, and it's why we'll stand up other facilities that are convenient for MTA workers subject to availability of the vaccine. All right, last question over here, John. Clayton, and then we're going to move along.
Okay. Pat, you're coming on a year of the first case at the MTA, obviously a huge surge last spring. Now you're really ramping up vaccination efforts. But what do you know so far about how and where and why the virus spread so rapidly last spring among your workforce?
Look, I think the question, Clayton, is why did the virus spread so quickly in New York and across the country? And with respect to questions like that, I will defer to the CDC, to the State Department of Health. Governor Cuomo has been quite explicit as to his reasons, his thoughts on the surge and the increase, and frankly, the fact that 500,000 Americans are dead as a result of the pandemic.
All right, thanks, everybody. We're going to resend now over to the vaccination location. Anybody with sticks wants to move over there, you're welcome to. We're going to start vaccinating with Patrick Foy. No audio on the nurse's questions before the shot, right? No audio here. Take pictures, no audio until she's ready to go.
My mask is on first, right? After I put the mask on the second time, I thought I put it on upside down. I had this the whole time after I spoke. I had this fear that.
Sorry, that's just going out live. I didn't want any conversation you guys had.
I was only talking about you.
Oh, thank you.
That was the most comprehensive and thorough consent information in history, and I thank you for it.
You're welcome.
My youngest daughter is an emergency room nurse, and we love nurses in our house.
One question I have to ask. Do you have any fear for needles?
No.
Are you comfortable?
Oh, yeah.
Okay. Okay. So,
Peter, give my regards to Rich Lamb on his retirement.
Thank you.
I'll take this one. So first, I just want you to raise your sleeve.
Sure.
If you relax the muscles, it won't be as painful. So what you would do, turn the hand up, right? Press the palm up. Relax, relax.
Okay.
Then you go down, right? Now I'm gonna clean the area, okay?
Okay.
Okay, so I'm gonna rest my hand on your shoulder. You are gonna feel a little pressure when I first insert, okay? Okay, you're in. You're all set. I'm gonna hold on to this.
Okay.
Hold on to it.
Got it.
I'm gonna put a Band-Aid on for you. Thank you so much. Now
Thank
you
you.
can release.
Okay.
And you're all set.
That was pain-free. Thank you very
Thank
much.
you.
That was awesome. Good.
All right, thank you, Pat. We've got other employees who are going to hang out.
Hey, how are you? Yep. Yep, it's crazy. How about you? Must be kind of trying to handle the fire.
All right, folks, same procedure every time, right? Medical questions, audio's off. As soon as we get ready to do the actual situation, back up. All right, thank you.
hand. Yes, that's good. Okay, so first I'm gonna clean the area, okay?
Yep.
Alright, so given that you have a tattoo, does your other hand have a tattoo as well?
Yes.
Oh, perfect then. Okay, so I'm gonna try not to put it exactly in the tattoo.
Okay. Yeah, you can get around it.
Yeah, I'll get it wrong. Okay. So you are gonna feel a little bit of pressure, okay?
Yep.
And
That was it?
put in a band-aid. It's not really necessary. You can take it off whenever you feel like it. But this is just in case you have any type of leakage, okay? Thank
So
you.
weird feeling is normal.
Yes, like if you feel a slight sting.
Tingle or-
Yes, that's it. Thank you.
That's it?
Yes, so you're gonna have to wait 15 minutes in the post-vaccination assessment area.
Okay.
Thank you.
Thank you. Thank you.
Yeah, exactly.
Good seeing you, my friend. Let's just keep it going through these people, same protocol, sound is down, sound is up, give them more B-roll, we're good, all right? I'm going because they're doing an interview with Craig. Can I just have that coat, please?
Yes.
Thanks very much. It's worked out.
gonna clean the area. Okay, so you're gonna feel a little pressure, okay? All right. All right, so I'm gonna put this Band-Aid. And remember, you're gonna sit and wait 15 minutes. When you're done, you will sign a post-vaccination assessment. You're all set to go. Okay? Thank you.
He's gonna take you to the waiting room.
first I'm gonna be cleaning the area, okay? Okay, you are gonna feel a slight discomfort, okay? Okay, so I'm putting a band-aid. You can take it off at any time. It's not really necessary. I'm only putting it just because you have a leakage. Okay? So you're gonna have a seat in the post-vaccination area, and you're just gonna wait 15 minutes.
Okay, thank you.
Yeah.
All right.
Does he have to take a timer with him?
Clean that area. If you hold on to it, it will be perfect. Thank you. Now relax the arm. Just relax. There you go. Okay, so you will feel a little pressure. Okay. Band-Aid just in case you have any leakage. Okay? Thank you very much. And you're all set. So you're gonna sit and wait for 15 minutes in the post-vaccination area. When you're done, you're gonna sign. That indicates whether or not you had any adverse reaction. Okay?
One other thing.
I need you to relax that arm. So if you put arms up and rest on the side, there you go. Nice. All right. So you are going to feel a slight pressure when I first apply. Thank you for assisting. All right, so you can take this off. Understand it is not really necessary, but if you feel it, if you anyway feel like taking it off, it can be removed. Okay?
Thank you very much.
And we're all set. You're gonna sit for 15 minutes. And once that 15 minutes is up, we'll let you know so that you can sign the supplement and you're free to go.
Thank you very much.
Thank you. Oh, there you go.